Access Coalition, on whose behalf I am speaking tonight, is a group of concerned caregivers and safety net providers who serve some of the most impoverished corners of Massachusetts, in Boston, in Lawrence, in Fall River, and Brockton, the very same communities that many of the Caritas hospitals serve. We understand firsthand how difficult it is to maintain access to affordable, quality health care under current conditions. That is why we have formed this coalition. Under the law governing the proposed sale, the sale must be in the public interest. To be in the public interest, the sale must not harm geographic or financial access to affordable, quality health care. Community health centers and community hospitals are tremendous community assets and essential components of the healthcare access safety net in Massachusetts. The Attorney General and the Department of Public Health should condition this sale upon specific enforceable healthcare access requirements that prevent diminished access to care and preclude the destabilization of the health safety net. Despite our tremendous success in achieving healthcare coverage in Massachusetts, we have a very fragile health safety net. Care provided to low-income populations in our Commonwealth is very poorly compensated. Consequently, urban providers have fewer resources with which to provide care. Access is already threatened. On the other hand, suburban providers that care for well-insured patients are financially strong and vibrant. As safety net providers and caregivers, we have many questions about the implications of this transfer on access, health status, and available services. Will this sale, for example, and the venture capital it brings lead Steward Cerberus to selectively market to the well-insured, or make decisions about the mix of services offered that result in a decline in needed services, leaving the responsibility of providing essential services for the underserved to the already overburdened safety net providers? Will Steward Cerberus use the for-profit venture capital to engage in pricing practices or physician recruitment strategies to gain market share profitability rather than to use the new capital to improve healthcare? Will Steward Cerberus business practices that seek market share gains and profitability destabilize safety net hospitals and community health centers? Is Steward Cerberus committing to maintain these Caritas hospitals, which have served their communities for decades, for merely 3 years? They have committed to only 3 years. Is the for-profit buyer significantly underpaying for these community assets? And shouldn't we ensure that the fair value balance go into a fund to support needed services for vulnerable populations? Our coalition is extraordinarily attuned to the challenges that have led Caritas to this sale. But a transfer of ownership of a nonprofit system of this size and significance to a for-profit is unprecedented and requires a higher level of scrutiny than we have seen in Massachusetts ever before. We know that you will consider very carefully the implications of this sale and conversion on the safety net, whether a 3-year commitment is sufficient, and what conditions will preserve access to care and prevent further erosion of the safety net. The Healthcare Access Coalition has developed a list of principles and concerns, which we will submit in writing tonight with this testimony. And we will submit more specific recommendations in writing at a later date. We sincerely appreciate the time the Attorney General has provided to us already and look forward to continued engagement with the Office of the Attorney General and the Department of Public Health in this process. Thank you.
The next speaker is